Welcome to Dr. Tom Talks. Today, a special on lupus or systemic lupus erythematosus. With the help of the BioDigital Human, I'm going to be talking about a brand new study that came out just a few days ago, which might actually teach us about the root cause of lupus, which isn't fully understood at the moment. I'll also be talking about some of the signs and symptoms, as well as how you can edit some of this to tailor it towards your own symptoms of this disease or any other disease. So first of all, let's talk about the name, systemic lupus erythematosus. So systemic means it could be all over your body. Lupus, I'll get back to in a second. Erythematosus, reddening of the skin. So lupus, for those of you Harry Potter fans out there, you may remember Professor Lupin. He was a werewolf. And lupus is the Latin for wolf. And it might have something to do with the fact that some of the rashes maybe look similar to a werewolf bite, or a wolf bite rather. But I don't know, the jury's still out on that. So what did the actual study show? Well, let's take a look. What they did was they took blood samples from 19 individuals with lupus and compared it to healthy individuals. Now, we already know that those who have lupus, they have an increase or an excess amount of type 1 interferon. Now, what we didn't really know was what kind of effect that would have on the body. But this study, what it showed was that it blocks a protein called aryl hydrocarbon receptor. And what that does is it has an effect on these white blood cells, these T cells. What it did was in blocking that receptor, it hindered the production of the good T cells, the T cells that can help heal wounds on the barrier of the skin, lungs, and gut. And it also reduced, or rather increased, the amount of T cells that were auto-antibody T cells. So T cells that then go and attack your own organ systems. And so it's that imbalance which causes all of these signs and symptoms. So looking at these signs and symptoms, there are so many with lupus, which is why it's kind of difficult to diagnose. But just to draw your attention to a few: fever, headaches, fatigue, malar rash is a really important one. And it's very, very sort of pathognomonic, which means like really, if you see it, you're like, okay, I think that's lupus. And you'll see this rash right here on the skin. It avoids the nasolabial folds. So if you're a little bit older like me, you have these like folds here when you smile, and it avoids those. So that's very telling of lupus. Chest pain, difficulty breathing, muscle pain, anemia, increased risk of blood clots, also numb and cold fingers and toes, also known as Raynaud's phenomenon, which I have a whole nother Dr. Tom talk on, which you can Google or look at it at biodigital.com, as well as joint pain and a few other symptoms. If you have lupus and these symptoms don't fit you, you can go into something called Human Studio in biodigital.com, and you can change that malar rash. Let's say you don't have the malar rash, but you do have mouth ulcers. You can literally write in mouth ulcers, and then you save your model, and you've got your own personalized model which you can share with your family, your provider, and it'll be here right here in your dashboard. So when I open that, you'll see mouth ulcers rather than malar rash. Just a couple of other points to note. It's a lot more common in women. About 90% of the people, estimated 1.5 million people who have it in the US, are female. And that's probably to do with the link that it has to do with the hormone estrogen. And the other thing is it's more common in the African American population. But if you need to know anything more about lupus, please go to biodigital.com. But of course, if you're having any of these signs and symptoms, it's best to go to your healthcare provider. This has been a Dr. Tom Talk. For any more information, please go to biodigital.com.